What's going on, guys? Jason here from the Comprehensive Dentist, and today we're actually going to be looking at some oral surgery setups. Now, behind me I have an oral surgery kit completely laid out. I got some things that would be found in a simple kit and some things that would be found in a complex kit. And we're actually going to go through each instrument and we're going to talk about what it is and how you might use it. And so in my experience, especially training up to 16 residents every year, I find that dentists a lot of times forget what the instruments are used for and kind of what they are. So I think it's important to review that stuff. So that's what we're going to do today. Hope you enjoy this. Let's get to it. Okay, so I had one of my assistants actually set this room up earlier. And one of the first things you'll notice when you look at this table is there's actually a cloth drape over all the instruments. We specifically do this because we don't want the patient seeing all the instruments and getting fearful of the procedure before they even sit in the chair. So a lot of times we'll wait till the patient's reclined before we undrape all the instruments. All right, so this particular kit here is the one that we use in the clinic that I'm currently working at. This is a little bit larger kit than the other clinic I work at. Some kits are going to be more simplified. Some kits are going to be a little bit more complex and have more instrumentation. A lot of times it comes down to how you're trained, what you use for specific situations you encounter when extracting teeth. So, you may not use all these instruments, but I think it's good to be familiar with them. And then as we progress through other videos and we actually show techniques, it'll be good to see some of these instruments in action so you can actually see what you're going to do with the instruments. All right, so when we're talking about actually cutting tissue, one of the main things you're going to use for this will be the scalpel blade. Now here in front of you, you have two different types of blade handles. The smaller one here is actually a number 3 handle, and the longer one is actually a number 7. Now you can imagine, depending on where you're working in the mouth, it's easier to work with one over the other. The longer one's typically going to be used for more posterior areas of the mouth, so you can get back there a little bit easier. My blade of choice is typically going to be the 15 blade, and that's what I usually prefer for oral surgery. Some people like the 12 blade. Either one's going to be fine. But I typically go with the 15. When you load the blade, you really need to be careful. It's not recommended that you use your fingers because if you accidentally slip, you could cut yourself. Try to use a needle holder to hold the blade as you place it onto the blade handle, or some other safe method. Typically when you hold this instrument, you're going to hold it in a pin grasp, and you need to be very deliberate when you use this. This is not some kind of instrument you want to just kind of have your hands kind of loosely holding, because this is dangerous. If you drop it on somebody, it could do a lot of damage. In this situation, we have two of the handles, so a lot of times we'll set up two 15 blades depending on the procedure. If it's going to be a very lengthy procedure, we're going to be doing multiple teeth, it's not a bad idea to have an extra blade handy, because the first one will eventually dull and not cut the tissue as efficiently. So it's good to have a second blade there so you can have another sharp blade handy for when you're actually doing that procedure. All right, when it comes to actually elevating the flap, typically you have two choices. You can use the Molt 9 periosteal elevator. You'll notice if you look at this instrument, it's kind of sharp, pointed at one end, and there's a broader, flatter end at the other side of the instrument. The point is good for starting the flap. The broad end is really good for like continuing that elevation, but you can also use the point as an elevator as well. I've seen that done before. You actually place this in between the teeth and kind of elevate using this instrument. So it's a pretty handy instrument. This is actually my preference because it's a little beefier, a little easier to hold, and I feel like I can just really do a really good job elevating the flap. The Woodson's another instrument that you could use. This one's a little bit more dainty, kind of in my opinion. It's good for initiating the flap. I personally prefer the Molt 9 though, but I know a lot of perio guys will use the Woodson to elevate flaps. It's definitely a little bit more delicate of an instrument. I don't feel like I can really leverage well with it, so that's why I don't really prefer that one, but certainly an option. Either one of those would work fine. All right, next we're going to look at instruments that you can use to actually retract tissue. Typically when we think about retracting, we're retracting the cheeks, we're trying to retract the tongue, maybe periosteal flaps. So you have a variety of options. Some of the most common ones would probably be the Minnesota retractors, these two here. These are a little bit bigger and they definitely retract more tissue. Great for cheeks, great for tongues. I definitely use those a fair amount. Some of the other ones would be like the Weeder tongue retractor. This one's always kind of interesting. I've also heard it called a sweetheart because it's kind of shaped like a heart. Very similar to like an Austin retractor. Good for cheeks, tongues, flaps. Sometimes will be serrated on one side to better engage the tongue, and you can actually see the serrations there on that side. So this is really good for retracting the tongue. I know a lot of people, if they're doing sedations, they will use these and kind of just leave them in place for the procedure. The Selden retractor is a little bit thinner. It's definitely got a smoother edge. Sometimes use these for like periosteal flaps. It's not as wide though, so that's one thing I don't like about it. If you compare it to the Minnesota, it's definitely not as wide as the Minnesota, so it's not as user-friendly in my opinion, but certainly not a bad retractor by any means. And then you have the classic, of course, mouth mirror, right? You can retract the tongue, the cheeks with that if you need to. And really, I would say for most surgery purposes, I'm normally using the Minnesota for retracting tissue. All right, so as far as actually grasping tissue, we have a few choices. One of the most common ones I use is this Adson forceps. This instrument's pretty cool because it's kind of a shorter tissue forceps. Sometimes it'll have teeth at the end, sometimes it will not. But this is really good for suturing. I love to use this as kind of like my second hand when I'm suturing, if I have it. Otherwise, it's really good for just grabbing any type of tissue, flaps, what have you. Another forceps I actually don't have out here. It's called the Stille's forceps. It's a lot longer than, say, the Adson. It's really designed for more posterior regions of the mouth. Of course, you have the cotton forceps or the college forceps. You pretty much use these in any discipline in dentistry. But you can use these for picking up loose tooth fragments, any types of foreign material, getting cotton rolls, that sort of thing. Of course, you have your hemostat. Hemostats, definitely good to know the difference between a hemostat and a needle driver. I will show you a needle driver shortly, but the hemostats can be straight or they can be curved like this one, and they have a locking handle at one end, so you can really use these for a lot of things. One of the main ways that hemostats are used for in a lot of surgical settings is actually clamp like an artery or a vein. Some hemostats have a straight serrated nib, which if you look at this instrument up close, you can see that the surface of that is kind of serrated, right? And the serrations are very straight. And so that's really kind of helps this thing grip whatever you're trying to use it for. Compared to needle holders, the surface here looks a lot different. So it's good to know the difference between those two. You can use these to remove granulation tissue, pick up tooth fragments, foreign bodies, etc. Alright, so next we're going to look at instruments you can use to actually remove bone. Pretty common instrument is the Ron George instrument. This instrument has sharp blades at the end that can be squeezed together. It's got an auto opening feature, so when you close it, it automatically reopens itself. The actual cutting areas, they can be on the side or they can actually be at the end, or it could be both. So typically you're going to use ones that have in-cutting features to place in the socket and to remove like interradicular bone. But you really don't want to use these to remove large amounts of bone. You really want to use these in very small bites. Very delicate instrument. Don't use this to remove a large amount of bone. Of course, we have our burr handpiece. High-speed handpiece, it's high torque. You're going to use sharp carbide burrs with this. You could use a 557, 702, 703, 8 round. A lot of times it comes down to preference. I really like 702s and 703s. But you want to use this to remove bone, especially if you're going to be doing troughing or sectioning of the teeth. Big thing is you need to make sure that the exhaust of this air is not going into the operating field. You really want a rear exhaust on your handpiece so you're not potentially blowing air into the underneath the soft tissue, causing subcutaneous emphysema. Other instruments that we have are the mallet and osteotome. Sometimes people call these the hammer and the chisel. The mallet actually has nylon tips on each side. These are really a shock absorber and a skid protection, so when you're using this it doesn't slide off of the osteotome. Those can actually wear out over time, and so you can order new tips and replace those if necessary. And most of the time, if I was ever going to consider using the mallet and osteotome, would be typically for like a maxillary third molar situation to remove some of the buccal bone to get better access to the tooth. And lastly, we have the bone file, which is a double-ended instrument that you can use to smooth the bone. The particular thing about this instrument is the teeth on this facing here, on that rough surface, really only allows you to remove the bone in a pulling motion. You can't do it in a push stroke. You have to do it in a pull stroke. So when you use that instrument, make sure you're using it correctly to get the most out of that instrument. And when it comes to actually removing soft tissue from any area in the mouth, whether it be from the socket or loose tissue near the flap, the curette really is the best instrument for that. This particular one is angled, it's double-ended. Some of the curettes can actually be straight. I prefer this specific type of curette here. But you can use these to remove soft tissue pathology from the socket, granulation tissue, remaining follicle, what have you. These are really great for removing anything of soft tissue nature from the actual socket. So for suturing, you're actually going to use the needle holder to hold your suture needle. This has a locking handle, and a lot of times these are a little bit shorter nib on these, and so it's going to have a blunted beak, shorter and stronger beaks than the hemostat in this case. So if you look at the face of this particular instrument, it's definitely going to look a lot different than the hemostat did. This typically has a cross-hatched face, allowing you to grasp the suture in multiple angles. I see a lot of providers try to use the hemostat to hold the suture needle, and it really does not offer you the best advantage there. It really forces you to hold the needle in a very particular fashion. When you use the needle holder, it gives you a lot more flexibility to hold the suture in various angles because of that facing. You typically need to hold the needle holder by using the thumb and the ring finger in the actual holes, and use your first and second fingers as a way to actually control the instrument when you're using it. So there is a proper way to hold this when you use this instrument. And of course you have your scissors. These are suture scissors, also called Dean scissors. They typically have a short cutting edge. You can use these to cut the suture, but if you use these for like cutting tissue or anything like that, you could dull those pretty quickly. So if you're going to use these to cut tissue, you really need to get tissue scissors and not use the suture scissors. Now, one other thing too is you're going to notice that most of the time these instruments are going to have like a gold coating to it. A lot of the suture instruments are coated very differently than other types of instruments. So that's something to help distinguish the difference between those. So when it comes to actually holding the mouth open, supporting the patient's jaw, there's probably not many options that are more commonly used than the actual bite blocks. These are great for supporting the jaw, protecting the TMJ from stresses of surgery, and obviously they come in various sizes. I do like using the child option more frequently. You know, the adult, as big as it is, I find it doesn't always fit in everybody's mouth as easily, so a lot of times I'll use the child bite block. I don't actually have a picture of the Molt mouth prop, but that's a side action mouth prop, or I don't have one here. I'll actually show a picture of it, but it's a ratchet type action. It can be used to basically adjust how much opening you want for the patient. And I see a lot of people use these for sedation cases when the patient's having a harder time opening and closing. You really need to be careful though, because you control the opening, so you could inadvertently open the patient too much and really stress the muscles in the joint. So be very careful if you use one of these. It's nice because, you know, if you look at the bite block, you know, it's a very solid structure, right? You can't really go past this material, but with the mouth prop, the area between the opening is basically, it's completely open. So it's nice you have that extra space to kind of work in there. It's not really in the way as much as, say, a bite block would be. Here we have a Copeland suction or a surgical suction. This has a very narrow tip on it, and it's really good for getting into sockets. But because the tip is pretty narrow, it's not great for doing large volumes of suctioning. And so honestly, we typically use this. Occasionally I'll keep a high evac suction nearby if we need to get a lot of stuff out, or a slow evac suction. But in some situations you may even look into what's called a Yonkers suction. It's basically an acrylic suction that's really used for large amounts of volume. Typically they use that more in an OR setting. For me, I'm using the Copeland suction on a more regular basis. Alright, when it comes to irrigation, I really like the 30 milliliter syringe compared to say like a monojet because it holds so much more volume. These are great to have 2 of these because I find that especially if I'm doing like third molar surgery or something that involves a lot of flap irrigation, having 2 of these is very handy. And it's nice because you get tons of irrigation. You're able to thoroughly irrigate under flaps, irrigate out the sockets. It's definitely way better because you can have better visualization of where you're working. You have a more clear field, and this is just great compared to those little tiny monojets. Alright, so when it comes to actually taking teeth out, you have your elevators and you have your forceps. Let's look at some of the more common elevators. Now when you use an elevator, you're going to use these to luxate the teeth from the surrounding bone, and it's really critical to loosen the tooth prior to applying a forceps to the tooth. And so when you look at these, all these are going to have a handle, and they're going to have a shank, and then they're going to have a blade on them. And so let's look at a few of the more common ones. This one here is a 301 elevator. I typically use this as a starting elevator. The blade has a concave side on it that is placed towards the tooth that you're going to elevate. The bigger one here is called a 34 elevator. It definitely has a bigger blade on it. And this one I typically use after I've used the 301. Once you've created room with the 301, this is really good for continuing to luxate the teeth that you're going to take out. This one here is curved at the end, so it basically kind of looks like a 301 that's been bent. And there's different types of elevators that come in this particular presentation. It could be a 77R, it could be a 92. This particular one is a 46R. And so it's curved on the end, and I find that these are really good for posterior teeth. Particularly, I like them for maxillary third molars, or really just any third molar for that matter, because it allows you to get in the back of the mouth and elevate a little bit easier. Sometimes these are serrated at the tip, and that gives a little bit more of a bite. Typically, the serrated ones are going to be the 77Rs or a 93. So there's a bunch of different types of elevators that look like that one if you are actually in the market for buying those. All right, some other elevators would be the Cogswell A. This one's very broad at the end, and typically I would use this more for if I'm going to section a tooth. So you do a trough in the tooth, and then you place this into the trough to actually apply force within the trough itself. So that's really good for that purpose. And then you have the Cogswell B or the B point. Yeah, both of these are sometimes called A point or B point. But this B point is really good for gaining like a purchase on the tooth. Say you drill a small purchase point into the tooth, and you can use this to kind of elevate the tooth out of the socket. So I would use that frequently for just getting a really good purchase on the tooth. Alright, some other elevators that you may use. Here we have the millers. There's a left and a right miller. The surface of these is kind of curved at the end, and these are really good for root fragments on like mandibular teeth. They're also really good for delivering out maxillary third molars to the distal buccal direction. So I really like those for that purpose. Here we have some Cryers East and West. These are typically for mandibular root tips, and you can use these either for mesial or distal root tips, depending on which root tip you're actually trying to get out. And then, of course, you have root tip picks as well. This is just one example of a root tip pick, but these are small at the end. They're really designed to kind of get into the socket, kind of in that PDL space, and you typically have right and left options with root tip picks as well, depending on which side you want to actually try to luxate. All right, next let's talk about some forceps. You're going to actually use these to remove the teeth from the alveolar bone. Now, the most common maxillary forceps would probably be the 150. You have 150s, you have 150As. 150As typically a little bit straighter at the end, and those are really good for premolars. Now, a lot of people will use the 150 for molars, but there's actually better molar forceps that do exist. So you're not necessarily 100% wrong if you use this for a molar, but it's really more designed for premolars and anterior teeth, like incisors and canines. I don't actually have this out, but there's also the number 1 forcep. It's more straight and can be used for maxillary, incisors, and canines. Although most of the time I find that I'm just using the 150 for that purpose. Now, because maxillary molars have 3 roots, and it's ideal to have an instrument that would be more concave to engage the palatal root and has a beak to engage the buccal furcation. So most maxillary molar forceps come in left and right options. Now here I have an example of a 53, this one's a 53L, so it's used for the left side of the mouth. But you can see when you look at that, it's pointed on this particular end here that you can see, and it's more concave on the opposite side. So one side's for the palatal root, one side's for that buccal furcation. Another instrument that you could also use is the 88R and 88L instrument. And this one's also designed the exact same way, but it's got longer beaks. And honestly, this is more of a kind of upper cow horn, much like the 23 cow horn we'll talk about for the lower. This is really the maxillary equivalent to the cow horn, that 88R and 88L. Now, I don't actually have a 210S forcep out, but I will show a picture of that. These are also really good for maxillary single conical roots. All right, so if we're looking at the mandibular arch forceps, the most common one is going to be your 151 mandibular universal forcep. Now, this is really designed for single rooted teeth, although I see a lot of people use this for molars as well. Again, just like with the maxillary arch, if you're using that for molars, you're not 100% wrong, but there are better forceps that are available. The 151 also comes in a 151A option, which is really good for premolars. I don't actually have this out, but there's a 151S, which is really for smaller teeth. It's got smaller nibs. It's good for tight areas. Really good for primary teeth. A 17, I don't actually have one of those out at the moment either. These are really good for lower molars. They have pointed tips that allow you to engage the furcation on both sides, and they're really not designed for conical roots, so these are really going to shine more if you're using these for molars. The 23, also sometimes called a 87, also known as the cow horn forcep. This has pointed beaks that actually enter the furcation, and these are going to seat by actually kind of pumping the handle up and down in the mouth, and that allows those tips to further engage deeper into the furcation. And those are just great for mandibular molars that actually have roots that are separated and have a good furcation. Last one I'm going to talk about here is the Ash or the English style forceps. These are really good for using on premolars and mandibular incisors. All right, let's talk about some other items you may want in addition to everything else we talked about. You're going to need some sterilized syringes for anesthesia. If you're doing multiple teeth, multiple sides, I recommend having 2 of those syringes. And then a lot of people will actually have a 15 scaler in their kit that they'll use to curette off follicle tissue or to remove tiny root tips. I don't typically do that, but it's not a bad idea. could be a very useful instrument. Some other things you're going to want are some extra suction tips, extra needles. Have some saline available, not sterile water. Saline is actually more physiologically compatible to be used as an irrigant for irrigating out underneath flaps and sockets, what have you. It's always a good idea to have some sterilized aluminum for covering like handles of like your lighting source, so you don't contaminate those areas. And then it's always a good idea to have plenty of gauze handy.